Preoperatively, you will be going for medical clearance. Medical clearance, simply put, is when you go to your primary care physician and he says you have certain medical conditions, but they are well under control, go ahead and proceed with your surgery. Or your primary care physician says to you, maybe you have some high blood pressure. It's not quite exactly where he would like it to be, so he would prefer that you postpone having the surgery. Most of the time, medical clearance is uneventful, but if there's any problem, it's always best to have that problem detected and taken care of before you have your surgery. When you come to Kenmore Mercy, that would be your pre-admission testing. At that time, you would have your lab work drawn. You would have your EKG done. You'll need to bring your medications to the hospital with you on the day of your pre-admission testing. The reason we ask you to bring them in the original container is because that is how we record your exact dose, frequency, the exact name and spelling of the medication, so there's no possible errors to be made. Please do not bring your own handwritten list. We always want you to bring the medications in the original bottle. We also want you to bring any over-the-counter medications that you may take. This includes vitamins and herbals. On the day of surgery, you're going to bring any medications that were added from the time you came in for pre-admission testing. So let's say you came in for pre-admission testing on the 10th. On the 12th, you went to your primary care physician, and he had some issues with your blood sugars. So he added a medication. We would not have that information communicated to us by the primary care physician's office. So it's important you would bring that new medication in the original container to the hospital on the day of your surgery, so we could then record that in part of your medical record. Medications the day of surgery, when you come in for pre-admission testing, we will instruct you on what medications you should take the day of your surgery with a sip of water, and what medications you should stop taking several days prior to your surgery. And that will be written on your sheet for you. Medications to stop before surgery, these tend to be your medications that will thin your blood. For example, a lot of people take fish oil. We tell people to stop taking fish oil. Some people will take baby aspirin for heart health. We want you to stop taking that prior to your surgery. And then donating blood. Very few of our orthopedic surgeons have their patients donate blood prior to surgery, but if your physician, your orthopedic surgeon, wants you to do that, they'll give you some more details as to when you should have it done and where you should have it done.